Oh, great. So this is the actual technique. I've just explained about the way to line the towels. Now we need to find a way to bring the shoulders out. So the first thing that I'll ask is the instruction I give to the client. Can you bring this shoulder outside? Yeah, bring the arm. And then if you can tuck this towel underneath. Yeah, good. Let them tuck it. It's simpler. Good. So I think most of you need to come from the back. Okay. Do you notice, what do you notice here? Anything that stands to be different, interesting, not different, but interesting, stands out for you?
Shoulder blade?
Yeah, isn't it? It's like, whoa. So that means that this person has quite mobility in the shoulder blade. Yeah? So the shoulder, have you seen how much it moves? Yeah? So there's something that just out of observation you can kind of decide whether maybe it's an observation you do and it might be just different than before. Okay? Anything else about the pillow? Do you think it's in the right place?
No.
Okay, so good. So lift your head please. Good. And then come and lie down. Good. So remember, the pillow is very important. Anyone has another pillow, longer pillow? Yeah? Not that I don't like these embroideries, it's fantastic, but when it comes to pillow, it's important to have a longer pillow, because when you put the head, it would not fall to one side or the other. Yeah, lift your leg. Good. Okay, so now we're kind of ready. I could do effleurage, pétrissage. This client may come with something that I might thought maybe looking into the infraspinatus muscle might be good. It might be the posture. Remember, we said that one of the indication for infraspinatus problem is protraction. It might be some pain they have here, or even in the front. Sometimes it reflects in the front. Arm ache. Yeah. So I need to come and to start palpate. So I would look for, when you do palpation, start maybe with a bit of a hole. Because if you start probing, it's going to take a long time, and it's kind of not very comfortable as well. So when you do the palpation, for you is a palpation, for the client is actually treatment. It needs to be as soft as that. So get the sense where it is. So what do you think is this one? Is this the middle border or the lateral border? Middle border. Can you bring, actually we'll do it after. This is the lateral border. And now I'm looking at, and you need to come quite close now. Yeah. So I'm on the lateral border. How do I do that? Every structure that goes this way, I won't palpate this way. I'll palpate across it. Because it will bring really the best palpation going over it. I'm on it, I'm over it. If you go this way, it's hard sometimes to know exactly where you are, yeah? So, okay, so I'm on the edge of the bone. Now, I need to go a little bit more in, and so you feel a ridge, yeah? So this is the ridge that you need to work on. Is it tender? Mm-hmm. Okay, now, when you're on it, then it's the, you need to work slower. You need to work slower, you can work with it. How's the tenderness? Is it okay? Can I go deeper? Is it deep enough? Do you feel anything in your arm?
Yeah, it's good.
It's a bit tingling, yeah? Okay, let's stay this way. And then leave it, okay? Mm-hmm. What I will do next is a bit of distraction technique, yeah? So I'll do that, especially if you have client that oh my God, you know, I call it the catastrophizing client. Yes, it's too much. And then you can do the same thing, but now do a bit of mobilization. Yeah? So, are you going to any vacation soon?
Yes.
Yes. Where to?
Barcelona?
Barcelona, good. You been there before?
No.
Okay. How is the tenderness now?
Good.
Good. So I actually involve in a kind of a different conversation, and I move. So the brain kind of distract a little bit. If you find that kind of you approach it, you push the muscle, but actually the client react badly into it. You need to go on the back door. You need to use some distraction, some mobilization, something to allow you to work more and persuade the body, persuade her brain to let go. And this is really the most of the work that you need to do. It's not about the trigger point and that. It's about actually the persuasion. It's about the dance. And it's about how you can lead them without them taking backward. Because it might be a bit achy. It might be considered to be dangerous. It might be considered to be discomfort. So how can you do that with enough persuasion? I can't use any different word to let it happen. Yeah, because if you do too much pain and you cannot distract it, you're limiting in the work that you can do. Okay. So again, finding it, holding it, and then even do a little bit of rotation. Do you feel more sensation in your arm now?
Yeah, well,
Is it still reasonable?
yeah. It's very nice.
Okay. Options 1. Options 2, if you feel that you can go further, then you can do it with a bit of more mobilization. So again, you need to use your 3-dimension anatomy. And the 3-dimension anatomy is that from anywhere in the body, you can come back to the same structure. So again, do you see the lower border of the scapula is kind of coming? Yeah, do you see it here? Mm-hmm. Yeah, good. You don't need to see, you need to palpate. So I feel the edge. So you need to go on the side. But again, what I'm doing now, for me is palpation, for the client is treatment. So be as gentle and considerate and non-probing as you can with it. Yeah? Do that. And then you're reaching to the same point, and you're looking at the client's face. And then be even gentler. How is it? So I start feeling that she's giving me a bit of a help. So now what I will do, I'll start doing unpredictable movement. So a little bit here. Okay, even something just light around, yeah? Even a bit less. There is a tendency to work on the extreme, stretch, stretch that. No, it's like imagine you have a knot on a rope. Do you want to open the knot while stretching it? No, you want to ease it. Yeah, so ease it at times. So do the same thing. It's kind of a bit of a more of a playful. Yeah. So again, my fingers on the muscles. Just do other thing. Okay. I think it's enough, isn't it? Should we stop now and you do it, and then we'll do the subscapularis next time? Yeah? Okay.
Yeah.
Let's go.